Good evening everyone, how are you? Hope you are doing good. Today I want to discuss one of the important anti-diabetic agent, that is DPP-4 inhibitors. Let's go into the topic. So what is DPP-4? Dipeptidyl peptidase 4, it is a serine protease that is widely distributed throughout the body, expressed as an ectoenzyme on vascular endothelial cells. It is also present on the surface of T lymphocytes. It is also available in a circulating form. So what is the function of DPP-4? DPP-4 cleaves the two N-terminal amino acids from the peptides with a proline or alanine in the second position. So it seems to be especially critical for the inactivation of GLP-1 and GIP. So what is the action of DPP-4 inhibitors? DPP-4 inhibitors increases the AUC of GLP-1 and GIP, like as stimulated by the ingestion of food. As the ingestion of food will also increase the levels of GLP-1 and GIP. Several agents, they provide nearly complete and long-lasting inhibition of DPP-4, thereby increasing the proportion of active GLP-1 from 10% to 20% of total circulating GLP-1 immunoreactivity to nearly 100%. So what are the DPP-4 inhibitors available? Sitagliptin, saxagliptin, linagliptin and alogliptin, they are available in the US, while vildagliptin is available in the Europe. So what is the mechanism of action of DPP-4 inhibitors? Alogliptin, linagliptin, sitagliptin, they are competitive inhibitors of DPP-4, while vildagliptin and saxagliptin, they bind to the enzyme or DPP-4 covalently. So all 5 drugs can be given in doses which lowers the measurable activity of DPP-4 by more than 95% for 12 hours. So by inhibiting this DPP-4, it causes a greater than 2-fold elevation of plasma concentration of active GIP and GLP-1. It's further associated with increased insulin secretion, reduced glucagon levels, and improvement in both fasting and postprandial hyperglycemia. Inhibition of DPP-4 does not appear to have direct effects on insulin sensitivity, gastric motility, or satiety. Chronic treatment with DPP-4 inhibitor also does not affect your body weight. DPP-4 inhibitors used as monotherapy in type 2 diabetes mellitus reduces HbA1c levels by an average of about 0.8%. These compounds are also effective for chronic glucose control when added to the treatment of diabetic patients receiving metformin, thiazolidinediones, sulfonylureas, and insulin, with a further reduction of A1C by about 0.5%. So the effect of DPP-4 inhibitors in combination regimens appears to be additive. Coming to the dose of DPP-4 inhibitors, alogliptin dose is 25 mg daily, linagliptin is 5 mg daily, saxagliptin is 5 mg daily, sitagliptin is 100 mg daily, and vildagliptin is 50 mg 1 or 2 times daily we can give. These DPP-4 inhibitors are absorbed effectively from the small intestine. Alogliptin, saxagliptin, sitagliptin, and vildagliptin, they circulate primarily in the unbound form, and they are excreted largely unchanged in the urine. So in presence of reduced renal function, their doses should be lowered. So the lower doses should be given to the patients with reduced renal function. Exception is linagliptin. Linagliptin binds extensively to the plasma proteins and is cleared primarily by the hepatobiliary system with little renal clearance. So the patients with reduced renal function, we can give linagliptin. Out of all these DPP-4 inhibitors, only saxagliptin is metabolized by the hepatic microsomal enzymes. So if you are giving saxagliptin with strong CYP3A4 inhibitors, its dose should be lowered to 2.5 mg daily. So what are the adverse effects of DPP-4 inhibitors? There are no consistent adverse effects that have been noted in the clinical trials with any of the DPP-4 inhibitors. Large cardiovascular safety studies have been completed for alogliptin, saxagliptin, and sitagliptin. There was no impact of these drugs on the incidence of cardiovascular events in diabetic patients. Although some patients treated with saxagliptin had an increase in hospitalization for heart failure. The FDA also has issued warning that this DPP-4 inhibitors is rarely associated with severe joint pain. This DPP-4 enzyme is also expressed on the lymphocytes. In the immunology literature, this enzyme DPP-4 is called or is referred to CD26. So effects on immune function of these drugs should bear scrutiny as more patients are treated with these compounds. Thank you so much for your kind attention. Kindly share my lectures to your friends.